Hi, Facebook land. How are you? You should be on Rodox. That's where you're finding me. And I'm Yvette McQueen, MD. So I'm going to give you a couple minutes to come into Facebook, into the page, because I have a topic I want to discuss today. I was invited to come talk about some diseases or some illnesses that you get from the floodwaters. So I'm going to give it about a minute. I said 4 o'clock p.m. Eastern Standard Time, 3 o'clock p.m. Central Time. Let's see here. So I know that there are some people from the Houston area that's listening. Thank you. And it's not just the Houston area, it's all of southern Texas that was affected. If you have power, that's great. If not, you can share and let other people know. So, yeah. Just putting up here so I can see who's coming in with me. I have Dr. Rowe and Dr. Karen. Thank you. Thank you. So, come on in and we will discuss medical illnesses and diseases that you get from the floodwaters. And my prayers are out for everybody from, there's Southern Texas, Corpus Christi, and Victoria, and Beaumont. Their water supply, their city water supply. So that's was just cut off, and they had to evacuate one of their hospitals. So I do understand that procedure, and of course the flooding in Houston, and then it's also affected western Louisiana. So that's important. So everyone's affected, and I want to make sure I get out there so that everybody will know what's going on. Okay, so I have about 4:03. I said about 4 o'clock Eastern Standard Time, 3 o'clock Central Time. Don't want to delay anyone's time because I know we're busy. So I am Yvette McQueen, MD, an emergency physician and travel doc. This is live, so someone decided to call me. But a global physician on a mission to educate about healthcare and travel wellness and disease prevention. So this topic here is on Rodox. Rodox is a telemedicine physicians that is Houston based. So we're Houston based, and that's where it was started. And they have several physicians to handle telemedicine care. You can reach out to them at rodox.com. Medical illnesses that you have in floodwaters. Well, first of all, let's talk about what is in the floodwaters. So, first of all, the waters came in from the ocean, so you're dealing with anything related to ocean and ocean bacteria. It came in and it was in contact with debris. It's in contact with chemicals that can leak either from houses, cars, gasoline leaks from cars because of flood waters, submerge cars. You're dealing with bacteria and sewage and human waste. There's definitely going to be leakage of sewage and human waste. And you're dealing with, of course, the animals like snakes and alligators and other things that's going to be in the water. So when you actually come in the floodwaters and you may come in contact with all of those objects or diseases and bacteria. Let's see who just joined me. Nutritional, and I'm Atandra, Dr. Atandra, the nutritional and personal trainer. She's on here with us, so thank you. So when you wade in the water, you definitely, as you go back to your homes, you definitely want to have yourself protected with the high boots, of course, gloves and things covered. But as if you were coming out of your houses bare and you have some skin exposed. So anytime the floodwater comes in contact with exposed skin, there's always a potential for disease. Of course, if it's exposed, then you can get a rash and irritation. That's the minimum you get, a rash and irritation in the area that the skin was exposed. The most problem we worry about is cuts, bruises, any open skin wounds. And if that bacteria, parasites, is in the water, it can actually enter into the skin. And there's different levels of it. It can just enter the skin underneath and cause a skin infection where it's just irritated and red, maybe a few bumps, a little swelling. Then you worry about the what we call a cellulitis, a skin infection. Make sure you keep in watch on that area, and it can be treated with an antibiotic. If it becomes like a boil or it seems to infested, as we call hot and angry, it may, and it can build up pus. It may need to be opened up. Of course, that is done by a healthcare professional. You can go to urgent care or ER where they need to open it up. The things we really worry about is those deep-seated infections. So if that bacteria or parasite got in and dug in and get down deep into that skin, it can cause a severe skin infection where the whole area is swollen. You develop boils with the lesions. They look like fluid-filled boils. And and then it starts to leak into your blood, and we worry about you getting sepsis. That would be the biggest issue for it to go on from just a simple skin infection to a full body blown infection. So sepsis means that the infections that started in a small area has now gone to your blood, and you'll get fever, aches, chills, and then you become just like sluggish. You need to go to ER. Just go. See, I'm an emergency physician, and I don't say go to the ER very rarely but this time, that's when you need to go to the ER. So remember, if you're going to be dealing with the floodwaters when you go back home, and protect your skin. And it's going to be hot, unfortunately. I know in the Texas area it's not about 90 degrees, but you have to protect the skin, so don't have your skin exposed. Okay? So that's one thing. What's the next one? Let's talk about if you were in the water, you was actually submerged up to your ears. You were walking, you fell in it, you got up. You can get water in your ears. So that's another thing, water in the ears, and that can be, of course, an ear infection that would need to be treated with an antibiotic. We don't want the ear infection to get worse, so take care of it and as soon as possible. The animals and other things that can be in the water. So you got to remember once again, snakes. Yep, venomous snakes. There are venomous snakes around. So snakes, you will get snakes in the water. You will get alligators in the water. You get the other little ocean animals, but most of the time, since it's stagnant, it will die. When you're going back home to clean up your house, and there may still be a small amount of water, make sure you're careful when you look under chairs, tables, things like that. Thank you for sharing. Yes, thank you for sharing. So we were talking about the floodwaters and illnesses and diseases you can get from that. So if there's any space between the floor and the item that you're clearing out underneath, you can get snakes hiding under there. It only takes a small amount of space. Their body is like compressible, and I'm from Florida. I see them all the time, and they just slide anywhere. Please, please, please be careful. Also, alligators, they're out there hiding underneath. And then also, because some animals were stranded or stray animals from the cats and dogs, make sure that they could be hiding in your house. They could have went. You got to remember, you went for to you was trying to go to high ground, a dry ground. Guess what? The animals was trying to do that too. So if they got stranded, they may be hiding in your house somewhere under a box, not under a box, but in a little space, like little cubby space, boxes here, little cubby space, cats, dogs, rats. Oh, please. Yes, rats are out. And so when you go to start to cleaning and putting your hands under things, make sure either they can get bit. So watch out for those animals. So best thing is for you to take a long stick or rake or something, and that's what you need to. Yes, the gators are so around. So like I said, I live in Florida. I have encountered alligators just hiding. Most of the time they're afraid of you, but if you corner them, if you're in a cornered area, they're going to snap back. So those are things that's from the floodwaters. So they went from the floodwaters into your house. So make sure you rustle things around before you go reaching under or reaching between things, because then you will have bites. And we'll talk about, of course, if you get a bite, you want that treated immediately. Of course, a snake bite, because then you don't know whether the snake is venomous or not. Of course, an alligator would clamp down and a dog would clamp down. So those. Be careful, cats and cat scratches, because then cat scratches can be very, very infectious. Within 6 to 8 hours, if you get scratched by a cat, it can travel, particularly it's on the hand, because that's what you was reaching, or it could be on the leg. It will travel up. So be very, very careful of those. Hi, Dr. Jackson. We're just in here talking about medical diseases. So we talked about what can be in the floodwaters and the exposed skin and infection and getting skin diseases. And I was talking about the animals that could be. Now I'm going on to standing water. So as one of the things that the standing water comes in, guess what? Mosquitoes. Yes, we know about those mosquitoes, and it's hot, it's humid. Standing water brings on mosquitoes, and there's a lot of mosquito-borne viruses that are around that you should watch out for. Of course, the first thing that comes to people's mind is Zika. Yes, Zika. Yeah. Okay, Zika. I'll give you that. It's around. But the one you really shouldn't really worry about is West Nile virus. The Zika is a small population. There's West Nile virus that has been around in the southeast area for ages. There's yellow fever. There's what we call dengue fever that comes up out of Caribbean. And then there's chikungunya. Yeah, it's a strange name, but it's out there. But all of these, the strange thing is all of these mosquito viruses, they present the same way. You're going to have the same symptoms. So you're going to feel feverish. You have flu-like symptoms. So you'll be like, why do I have the flu? But you'll have had mosquito bites, and you've had mosquito bites. But then you get flu-like symptoms where you get the muscle aches and pains, the joint pains. You get a fever. You're sluggish. You're feeling ill. Of course, unfortunately, because of viruses, sometimes there's not much we can do about it. But if it progresses on to remember I talked about that sepsis before? Yeah, you need to look at that high fevers. You have neck pain, you have severe headache. Go to your nearest emergency room. Tell them that you was exposed to the floodwaters. Tell them you have to tell your emergency people all this. You're exposed to the floodwaters. I got a lot of mosquito bites. I've had a high fever. I got neck pain. I get head pain. Go to the emergency room. Please, 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 please do that. And then let's see, what else are we talking about? And the big one is your gastrointestinal, GI, and the famous nausea, vomiting, diarrhea. Nausea, vomiting, diarrhea. Yeah. So with the floodwaters, some of the bacteria we worry about is Vibrio, E. coli, Shigella. Vibrio will come with the ocean water. The E. coli is coming from that sewage and human waste, and also the Shigella bacteria. Those are the biggest culprit. And those, if you, of course, ingest any of the water you swallowed any of the water, your hands then become contaminated, and little kids put their hands in their mouth all the time. So this will cause nausea, it'll cause vomiting, it'll cause that loose diarrhea, where you go into the bathroom, the abdominal cramping, you can't keep anything down. Of course, that presents to dehydration. And sometimes even in your diarrhea, you may see blood too. So you need to go to the emergency room. Okay. You can go to your regular doctor if your doctor is available, but we know that the care right now is, of course, you go to your healthcare provider, but you need to go probably to the emergency room because you will become dehydrated real easily. Yes, and once again, when you go to your healthcare provider, whether it's your primary care doctor or you go to the emergency room, please, you need to say, I was exposed to the floodwaters. That's what you got to say. I had a cut. It went in my ear. It was, I unfortunately swallowed some of the flood water. You have to tell them that information so that we can start seeking out the things that we need to do and send you to the appropriate care. So we worry about, like I said, with the persistent diarrhea and then you not even keep anything down, you will get dehydrated, and that can actually end up putting you in the hospital. So please take care of that. And also spoiled food. So this isn't like dealing with the floodwaters, but because of the hurricane, you got displaced from your home. Lights was out, power was out, food is still in the refrigerator. Or, and I'm being honest with you, if you're eating out in the fast food areas or the restaurants, you got to think, they were in the same area as you. Their food was in the refrigerator. Have they gotten new food replacements? One of my colleagues that's there in the Houston area is telling me she's in the ER seeing many people with food poisoning right now because they can't cook at home, so they ate at a restaurant or a fast food place, and unfortunately people are not throwing out their food. So you can get food poisoning, and that also presents as nausea, vomiting, diarrhea. So you need to be careful. I know, right? Angry is angry. Why with food? But you gotta throw out food, and people don't want to throw out food, and then they'll even say, "My lights was only out 4 hours." Sometimes that can make a difference, especially the dairy, the meats, the eggs. So make sure those are you're not contaminating yourself. Or also, if you're gonna eat out, it's okay for a restaurant to say, "Did you get a new shipment of food? Or are you using the same one that before the hurricane that you thought was frozen and then it became unfrozen, but they say, oh, the refrigerator was still cool, so it's okay." No. So once again, you get abdominal cramping, you get some nausea, you get the loose diarrhea. If you start to have definitely blood in your diarrhea, please go to the emergency room, get some hydration in there. So, some things I talked about open wounds. So one of the things we worry about is tetanus. Dirt is in floodwaters. So if dirt was in the floodwaters and you have an updated tetanus shot, you can get tetanus. Tetanus, we always and you're always like, oh, I got a wound, I don't have to worry about. But tetanus is actually a life-threatening disease, and it get where they say you get lockjaw. So your jaw won't move. But what happens is you get paralysis of your muscles. So if you're getting paralysis of your muscles here, guess where you're getting paralysis of your muscles? In your airway. Yeah, it's just funny. I do that for my nieces and nephews, make a lot of faces. So, but yeah, you get a paralysis of your muscles and you can't breathe. So, so if your tetanus shot is not up to date, you've been exposed to the flood waters. I know they was doing this at some of the medical areas in the convention center and other places. Please go get a tetanus shot. Your other vaccinations that need to be updated, check with that. Of course, long term, there's some problems that's going to come with the hurricane. We've seen it in other situations with cholera, because the water supply, your city water supply, you need to check. Did the pumps go off? Was the city water supply contaminated? And that's why they give out bottled water, because once again, the sewage and waste go into the city water supply, and they need time to actually clear that out. So you do need to you need clean water. So clean water to once again, you got those cuts on your hands or your legs. You probably should use bottled water to clean it off. Of course, get some supplies like hydrogen peroxide, alcohol stings. I'm not going to, or there's wound cleansers out there that you can use to do it. But bottled water to wash your hands, bottled water to brush your teeth. People forget about this too. So you got to remember, and we do this a lot on a lot of our mission trips in the third worlds. Well, we use bottled water to brush your teeth. You now need to do that. Texas, Louisiana, people that was exposed. Because if your city water is contaminated and we just automatically put our toothbrush on and do that, and our teeth is exposed, yeah, you can actually enter bacteria into your mouth. So use bottled water to brush your teeth. Put water on your toothbrush, put the toothpaste on, rinse it out, drink a little water, spit it out. And rinse it off. So use bottled water to brush your teeth. Dr. Karen says, children in the U.S. are usually required to get tetanus boosters in order to enter 6th grade. Yes, okay. Yes, they are. So children, when they're born, or don't get me, I'm not the pediatric, but at a young age, they do get the DAP, the DAP, which includes tetanus. And then they get the booster to go into 6th grade, Dr. Karen says. Well, unfortunately, yes, they have it at infancy, which is the DAP. And then they get the booster at 6th grade. And then I think you also get the booster, again, I thought high school, but I'm not sure. But adults, if you have not had the DT, or what they call the Boostrix, if you have not had that in the last 10 years, you need that tetanus. Unfortunately, there are children out there that are either immigrants to the United States that have not had that tetanus, or you're dealing with people who have chosen not to vaccinate their children, have not had it. So always that should be a question that should be considered. Other things you need to do, so wash your hands, keep your hands washed, don't try not to put them in your mouth, use clean water, use bottled water, things like that. So if there's any questions out there, just type them in, I'll try to answer them, but I talked about, so I'm just going to do a rundown again. What's in the water? Debris, bacteria, parasites, alligators, snakes, chemicals, human waste from sewage, your exposed skin. You can start off with a small rash or irritation. It can go into an infection, particularly if you're having cuts and bruises. It get underneath the skin, becomes cellulitis, things like that. And then it can get deep-seated and go and into your blood. And you don't want to do, hi, Dr. Tony, I'm just doing a recap. So then, of course, it can get deep-seated, go into your blood, and you get sepsis, which I told you is like, high fever, chills, body aches. A lot of people like to say lethargic, but you're sleepy and sluggish. You need to go to the nearest emergency room. So this is a wrap up. Remember, rash, you can start exposed skin rash. So when you're back home cleaning it, make sure you're covered, those high boots, wear gloves, wear long sleeves so you're not exposing your skin to the water. Dr. Karen says, if someone cannot get to a medical center, what is the most important treatment to concentrate or until you can get help? What is the most important treatment? Oh, someone can get to a medical center. You need to get to, that's a good question, and I'm not in that situation, but if, of course, cleansing, clean water. Remember I said your wounds with clean water, If you can get a skin cleanser, or if you have some antibiotic like Neosporin, bacitracin, put it on there. You can put it on there. That's what you just stay hydrated. We talked about dysentery and GI problems. Yes, you got to stay hydrated. So if you're having diarrhea, and what I tell patients, that if you're having diarrhea, you're having those loose stools, diarrhea, every time you go to the bathroom, you need to drink a glass of water. And I know water is a high commodity right now, but what if you happen, a kiddo accidentally ingests contaminated water? That's just it. If you ingest contaminated water, they most likely, there's always a chance that they will get the nausea, vomiting, diarrhea. Like I said, the bacteria you worry about is E. coli and Shigella, and it's going to cause the stomach cramping. The hydration is the best thing, and if it continues, they need to go to a ER and get hydrated up. Of course, the problem is you don't want to get Imodium, because then you don't want to take some medicine to trap the bacteria in it. It needs to flush out. So just water, water, water. So every time you have a loose stool, and every time you drink water, you drink a glass of water to compensate, to stay hydrated if you can't get to a medical center. Okay. Fluids and rinse and fluids. Yes, fluids. Bottled water. Once again, you need clean supply, bottled water, and rinsing those wounds. Rinse them with bottled water, and rinse them with a cleanser or the Neosporin, and watch it. And if it gets angry and hot, that angry and hot wound, and it's looking swollen and deep and boils pop up, it needs to be taken care of. You make sure you're brushing your teeth with bottled water. Make sure you're watching for animals, snakes, alligators. Those red ants are floating on top of that stagnant water. They're like, you say, oh, this is a little brush, and it's a bunch of red ants. And many bites from those red ants, they can be very venomous, just like a snake bite, and that can cause a severe infection on you. What do you recommend a first aid kit for those who have access to a pharmacy? So in a first aid kit, what you need is, of course, you need some antiseptic, or what they call wound cleanser. You need Band-Aids, or you can get the different side Band-Aids. You need, the antibiotic ointment, either Neosporin or bacitracin, whatever the brand is. It can be the pharmacy brand, to put on the wound. Sometimes I tell people, like, the wraps, you'll see the roll wraps, because if you have a bigger wound, you have the roll wraps. You need to roll it, and like if you have a cut that's bigger than what a Band-Aid is, you can cleanse it out with the bottled water, put the antibiotic ointment on, and then do a wrap, and just keep it dry. Now, you want to, of course, if you have that and then you don't want to get wet again, get a Ziploc bag, get some plastic, saran wrap, whatever, and tape it around you. That's the old home remedy. You don't have to get those wound bandages that they sell. Just get a bag, plastic baggie, or some saran wrap, and tape it around you. That's what I get. Of course, you want something for pain. You need whether you're using ibuprofen or acetaminophen. You need that in your first aid kit. That's some of the basics you need. Of course, for if you need allergy medicine, because you are going to be exposed to a lot of allergens and molds and things like that. That's what you can get. So wrapping up again, wash your hands with clean water, drink bottled water to stay up with it. Vaccinations, we talked about that. And let's see what else. We talked about, if you got submerged, you can watch for your ears, water in your ears, things like that. So if there's no more questions out there, I hope this was helpful. It was about medical diseases and illnesses. You can get from the floodwaters, wound cleansers. If someone, oh, great, thanks. And if you know anything else, you can add. Did I mention bites? Yes, I did talk about bites. I talked about snake bites. I talked about, there's snakes out there. I talked about alligator bites, and I talked about rat bites, and I talked about watch dogs and cats, that when you're cleaning out your house, that they're hiding in small corners, areas, under tables, under chairs. Don't stick your hand in there, rustle around a little bit. But if you do get bitten, take care of it immediately. Once again, treat it like any other wound. Cleanse it out with a bottle of water. Watch it. Snake bites, just go to the emergency room or wherever you can find. And of course, snake bites, if you can't get anything, we don't recommend a tourniquet. We just got to watch it. And you just need to watch it. But if it's traveling up over a joint, if you get bit on the hand and it goes over your wrist joint, you need care. If you get bit on the arm and it goes over the elbow joint, you need care. You just need care if it's a snake bite. I can't tell you anything else about that because it may be venomous, it may not, and there's just certain things that we only can do in a hospital for you for that. But no, we don't no longer recommend a tourniquet for snake bites, but watch that. And I'm bringing this broadcast from the Facebook page of Rodocs. That's ROWE Docs, DOCS. They're a telemedicine physician group based out of Houston, Texas, and you can reach them at rodocs.com to find a healthcare provider near you. They're across the United States. And I am Yvette McQueen, MD. That's YVETTEMCQUEEN, MD, a global physician on a mission to teach about health, travel, wellness, and disease prevention. You can find me on any social media, Facebook, Twitter, Instagram, Google+, YouTube, under Yvette McQueen, MD. And you can also follow me on Monday afternoon at 3 o'clock p.m. when I have a session, Thoughts from an Emergency Doctor. So, Houston, Texas, Louisiana, Beaumont, Victoria, all of you out there that was affected, stay safe, stay productive, and we're praying for all of you, your wellness, your health, and just life. So take care. Ciao.